Coronavirus going on around now in the society. Interestingly, we've gotten a case now in Lagos State, and I want to believe that will ginger everybody to want to know about what coronavirus and the implications are to himself, herself, or the society.
The health ministry said the COVID-19 virus reached Lagos State through an Italian citizen who had returned from Milan earlier this week.
So we have a traveler that started his journey from Milan on Monday, the 24th of February. He transited through Istanbul on Turkish Airlines and arrived in Lagos on Monday night at 9 p.m.
It's a virus, a germ that's like common cold gets into the system, and it has a situation in which the target area is going to at the lungs, and that is what differentiates it from the other types of viruses we've been having. The way we can get coronavirus are two ways, and it's through droplets from the person who has it or through droplets on the surfaces around where they can be. When we talk about droplets in the atmosphere, what do we mean by that? We're talking about a situation in which a person that has the disease, that is coronavirus infection, coughs, sneezes around you, and then you are close to that individual. The droplets from the sneeze gets to your face or your nose or your mouth, and you take that in. You can get the virus through that area. Another situation will be a situation in which the person who has the virus coughs, sneezes onto his hand, onto the table, even the knob of the door, and you as a neutral person shakes that person's hand, touches the table that person has just sneezed upon, you can get the virus through that. Why? Because we know the virus as of now can stay between 2 hours to 2 to 3 days on any surface it is on. By the time you touch your own face or mouth or even wipe your nose, you will transmit the virus to your own self. The incubation period, what do you mean by incubation period? The period between the time the virus gets into your system and the time you start showing symptoms can be a whole week. So you can have touched the table on Monday and the symptoms may not start showing till Sunday. And that is where the contact tracing, that is knowing people who have touched or have gotten in touch with you, is important. Interestingly, the symptoms of the coronavirus, the first few symptoms are like the common cold. You'll be sneezing, you'll be having cough, you'll be having general body pain, and you'll be having fever. And in most cases, those are the symptoms you will have. And unless the doctor has a high level of suspicion for that disease, you may just believe you're having a common cold or probably incubating malaria around this area. But like I said initially, the target area where the virus wants to go will be the lungs. And of course, the virus attaches itself to the cells of the lungs and starts increasing in size or in numbers. And by the time that arises, you start having a situation in which you have difficulty in breathing and rapid breathing. And then, of course, chest pain. And that is where the disease is very deadly. As of then, the person will be in the hospital.
3 more people have tested positive in the UK for coronavirus.
Every single delay in testing means potentially the virus could go to hundreds or thousands or more people.
And in Europe, Italy is the worst affected, more than 220 people.
565 people are dead and more than 28,000 infected with coronavirus around the world. That's if the Chinese are telling the truth.
As of now, there is no cure for coronavirus. Prevention is the main thing in this situation. And for each individual, the common advice is number 1. Anybody that you know that is coughing, sneezing, or having high fever, as the common cold usually have, be about 5 to 10 steps away from that person, so that at least by the time the person sneezes, of course, you know that the droplet will not get to you. And of course, avoid crowded areas where you think somebody that may have it may be there. As of now, they are still doing the contact tracing in Lagos. So we do not even know the other people who had gotten in touch. And I'm sure Lagos State will get that one sorted out very, very soon. The virus will not survive soap and water. So we usually encourage everybody as many times as possible, wash your hands with soap and water. Try not to touch your face or not shaking hands. Do we really need to wear face mask? I think as of now, those who have the confirmed disease should be the one to wear the face mask so they do not transmit it to other people. We do not as a group. Interestingly, the face mask actually does not actually prevent fully the transmission of the coronavirus because of the way it is. Because there are some pockets at the sides of the face mask where the droplets can still go in. The ideal face mask usually used is the type the people treating, the medical personnel treating coronavirus patients they use. And that one covers the nose and the mouth, and there is no space around it at all. That's the ideal face mask one should use when trying to prevent coronavirus transmission by uses of masks. What about our lifestyle as social people in Nigeria? We go to clubs, when I mean we, I mean the millennium and the Gen Zs as they are called. In many countries now, because of the fear of cross-transmission, most of these countries and cities have been closed down. That is, people are just allowed to stay indoors, not to go out, so that there's no transmission from the people who have the disease to the new ones. But I don't think that can be possible in Lagos. The millennia, they are quite healthy. They have a high prop level of immunity. The possibility of the immune system fighting the disease for them may be there, but what we want is not even to get the disease at all. The first doctor that died out of it was 32. So he's still in his prime of life. And also I want that to know that the two extremes of life, the young ones and the very old, they have high level of susceptibility to get the disease and compared to those who are quite active and moving about. The most important way to prevent the disease is, like I said, the best personal hygiene. That is, washing your hands with soap and water regularly and most of the time and all the time.